Welcome, dear students. Uh, in the lecture series of first aid related with wounds and injuries, I welcome you. This is in continuation with the first. This lecture is in continuation with the first one, and in this lecture we shall discuss about head, chest, and abdominal injuries. So, as you can see that in our head, the scalp has many blood vessels near the skin surface. Actually, blood is a highly vascularized organ and it consists of a dense network of blood capillaries. So obviously, the skull will also have many blood vessels near the skin surface, and any cut can result in profuse bleeding and may make the wound appear worse than it. So in case of severe head injury, a watery fluid that is called cerebrospinal fluid and blood may flow out of the nose, ear, or mouth. At this point, you should know that uh, ENT, ENT means ear, nose, and throat. They are interconnected to each other. You might have heard about ENT specialists, the doctor which are specialized in ENT. Let's see first aid measures in case of suspecting a severe head injury. So first, ask the injured not to blow his nose. So this is very important, that the person who has severe head injury, he or she should not blow his nose. Suppose if there is a blood or cerebrospinal fluid is present in his nose, and if he blows his nose, then it will clears a passage, okay, for cerebrospinal fluid and blood. Therefore, it is suggested that these patients should not blow his nose. Now, do not pack the ear or nose. जो ear और आपके nose हैं, they should not be entirely packed, and you may eventually place a light dressing on the ear or nose. Okay, if the person is breathing, put him in recovery position. Actually, this is a specific position. In recovery position, the airways are always clear. The patient's hand supports his head and knee stops to body from rolling onto the stomach. Actually, this is a specific position. You can see the diagram of a recovery position on in internet. And then be aware of the risk of the neck or spinal injury. This is very important. And in this case, urgent transport to the nearest hospital is essential. It means as a person meets a head injury, immediately the injured person should be transported to the nearby health facility center. After taking care of the patient, the caretaker must wash his hands using soap and water, and if soap is not available, then he or she can use ash, and alcohol based sanitizers can also be used. So the second is nosebleed. So as we know that our nose contains small blood vessels that can bleed easily. Actually, the blood vessels of the nose can be easily ruptured. They are very delicate. So a nosebleed can be result of a blow to the nose or a trauma to the face. Actually, in normal blow, the bleeding in general not occurs, but in case of forceful blow, the bleeding may occurs, and in case of a trauma also, but can also occur spontaneously. This is important. Sometimes nosebleed occurs spontaneously because of dryness inside the nose. Okay, so there are other regions also, and these include foreign objects in the nose, infection, common cold, allergies, high blood pressure. High blood pressure is very important. In case of high blood pressure, the nosebleed occurs spontaneously without any reason, without any blowing. Just blood pressure goes on high and nosebleed occurs. High altitude, a dry environment, alcohol abuse, disease, and the use of certain medications. So these are the factors which can influence your nosebleed. So during a nosebleed, the blood may flow from one or both the nostrils. Okay, so from one or both the nostrils, blood can flow. This flow may be last from a few seconds to several minutes, and bleeding occurs either drop-wise or maybe in the form of a continuous flow, है ना, दोनों तरीके से bleeding हो सकती है. And the rate of drops may be slower or faster. जो आपका bleeding का जो rate है, अगर drop-wise bleeding हो रही है, then its rate may be slower or faster, or in some cases the continuous flow of blood may also occurs. Now let's see the first aid measures in case of a nosebleed. So ask the person to pinch his nose above the nostril with index finger and thumb, है ना, index finger और thumb के मदद से nose को क्या करते हैं, pinch करते हैं. As you can see in the diagram, tell the injured person to breathe through the mouth. So obviously the breathing will be performed by the mouth only. Ask the injured person to lean forward, आगे की तरफ झुक जाए, to lean forward so that he does not swallow or breathe his own blood, है ना, तो अपना खुद का blood को swallow होने से बच जाए. Swallowing blood can make the person feel sick. Now pinch the nostrils for 10 to 15 minutes. Yeah, you can say unless the bleeding stops. If necessary, pinch the injured person nose yourself. यानी कि जो आपको first aid provider है, he or she can pinch the injured person nose also. In a few cases, a nosebleed can be serious and lead to death. है ना, कुछ cases में आपका जो nosebleed है, it can be serious and it may lead to death. अगर ज़्यादा blood loss हो जाता है, then it may lead to death. The person should seek medical help if blood is still coming from the nose after 20 minutes. यानी कि nose pinch करने के 20 minutes के बाद भी अगर bleeding जारी है ना, bleeding stop नहीं हुई है, then this is a serious case. The nosebleed was caused by a hard punch on the nose. Suppose किसी ने hard punching की उसके nose के ऊपर, सीधे nose के ऊपर hit किया है punch से, तो इस केस में भी आपको जो है serious है, it's a serious risk. A fall, a road accident, अगर fall कहीं गिर जाते हैं आप या road accident में nose पे जो injury हो जाती है, then you need medication. Blood spurts from the nose. Nose से धीरे-धीरे blood आता रहता है. The injured person turns pale, becomes sleepy or fall unconscious. So in all these conditions, the person should seek medical help. And after providing the first aid measure, the person who has provided the first aid measure, he or she should use soap and water to wash their hands. If soap is not available, again you can use ash, or alternatively alcohol-based sanitizer can be used. Next is bleeding of the gums. So bleeding may occur immediately or after some time after a tooth extraction. It means tooth extraction may be followed by bleeding. Okay, so let's see the first aid measures in case of bleeding of the gums. The person may rinse his mouth with water or saline water. So saline water is preferably should be used, है ना, अगर saline water available है, then it should be used. A thick cotton ball can be put in the casualty. Casualty means the injured person, है ना, please do not confuse with the word casualty. Casualty does not mean the dead person, it means the injured person. So a thick cotton ball can be put in the casualty's teeth socket and tell him to bite on the cotton ball to stop the bleeding. यानी कि जो injured person है उससे कहा जाए कि जो cotton ball है उसको उस गम के ऊपर जहां से आपकी ब्लीडिंग स्टार्ट हो रही है उसको प्रेस करे अपने टीथ से, सो दैट ये आपकी जो ब्लीडिंग है वो स्टॉप हो जाए. Refer the person to a healthcare facility, and finally the person should be referred to a healthcare facility. Now the next one is chest injuries. So chest injuries are very important. As you can say, injuries to the chest are always serious without being visible. There might be fracture of the ribs, tear of the lung, injury to the heart and injuries to blood vessel. Actually ये जो injuries हैं, ये जो chest injuries हैं, they are not visible, means they are the part of internal wound. हमने first lecture में define किया था कि what are the external wounds and what are the internal wounds. So chest injuries can be considered as an example of internal wounds because you cannot see them. So in case of a penetrating injury, a condition called pneumothorax may occur. What is pneumothorax? Air can enter between the lung membranes. As you know, our vital organs are surrounded by two membranes. One is called parietal peritoneum and another one is called visceral peritoneum. तो जो space है इन दोनों के बीच में, it means the intermembranous space between parietal peritoneum and visceral peritoneum is filled by the air. So in this case, air can enter between the lung membranes and exert pressure on the lung. Obviously, जब अगर membranes के बीच में air आ जाएगी, तो that will make a pressure on the lung and make the lung to collapse. लंग आपको collapse हो सकते हैं. The pressure may build up, affecting the other lung, making the injured breathless. ना अगर एक लंग में आपका इंजरी हो जा रही है तो दूसरे लंग को भी अफेक्ट कर सकता है. ठीक, in case of pneumothorax. Air may also come out from the wound during breathing. ठीक है, आपका wound से भी air आपके पास हो सकती है. So let's see first aid measures in case of a chest injury. So what are the first aid measures in case of a chest injury? So here are the first aid measures. First, place the injured person in a half sitting position, as you can see in the diagram, and control the breathing by providing डायरेक्ट प्रेशर टू द वुंड. है ना, चेस्ट में जहां कहीं पर भी वुंड है उस पे डायरेक्ट प्रेशर अप्लाई करके ब्लीडिंग को स्टॉप करने की कोशिश की जाती है. लीव द ओपन चेस्ट वुंड एक्सपोज्ड. ओके, डू नॉट अप्लाई एन ऑक्लूसिव ड्रेसिंग. यहाँ पर ड्रेसिंग अप्लाई नहीं की जा रही है. इवेंचुअली पुट अ लाइट ड्रेसिंग ऑन द वुंड, यानी कि ऑक्लूसिव ड्रेसिंग प्रोवाइड की जाए. आपका जो अदर केसेस में जो ड्रेसिंग प्रोवाइड किया था उस तरह से ना की जाए. लाइट ड्रेसिंग ऑन द वुंड दैट इज नॉट ऑक्लूसिव. रीएश्योर द कैजुअलिटी, यानी कि जो आपका इंजर्ड पर्सन है उसको आप रीएश्योर करें. देखें इसको. यू मे आल्सो encourage the injured person to lean forward the injured side and use his hand to cover the penetration wound, as you can see in the diagram. If the casualty becomes unconscious, यानी कि जो injured person becomes unconscious but keeps breathing, put him in the recovery position. Again, अभी हम आपको थोड़ी देर पहले explain किया हमने what is recovery position. तो recovery position में patient को आप फिर से डालते हैं. Now, if the casualty stops breathing, start CPR. CPR is very important. CPR stands for Cardiopulmonary Resuscitation. It is called Cardiopulmonary Resuscitation. Actually, it is an emergency procedure consisting of chest compression, often combined with artificial ventilation. है ना, तो chest compression किया जाता है and is often combined with artificial ventilation. Arrange urgent transport to the nearest hospital. ठीक है, and after taking care of the person, the first aid provider should wash his hands with soap and water. Soap is not available, again you can use ash, and alcohol-based sanitizers can also be used. Now the next one is, I think, yes, abdominal injuries. So stab wounds, gunshots, or crush injuries to the abdomen cause serious and potentially life-threatening wounds. Now we have already discussed stab wounds, gunshots, and crush injuries in the first lecture. So here we no need to discuss all these things. So let's see first aid measures in case of an abdominal injury. So first, control the bleeding by providing direct pressure to the wound. So the first step is almost common. Then put a clean cotton bandage on the wound. Adjust the position of the victim so the wound does not gap. Gap means जो आपकी wound dressing है, the dressing और जो आपका wound bed है, इनके बीच gap नहीं होना चाहिए, है ना. कभी कभी क्या होता है कि ड्रेसिंग की जाती है तो जो आपको एक्चुअल में जो wound होता है, जो ड्रेसिंग है उसके बीच में गैप हो जाता है. सो इट मींस द स्पेस बिटवीन द wound bed and wound dressing. तो जो wound bed और ड्रेसिंग के बीच का जो गैप है should be minimum. So adjust the position of the victim so the wound does not gap, or it should be minimum. If the intestine comes out, है ना, अगर आप कोई severe injury है, severe abdominal injury है, and the intestine comes out, cover the intestine with a clean plastic bag or a clean pad. Do not touch the intestine with bare hands. Intestine को आपको touch नहीं करना है. That come out. Do not give anything to drink or eat. Obvious सी बात है, intestine आप बाहर आ गई है patient की, तो he or she should not give anything to eat. If the casualty becomes unconscious but is breathing, put him in recovery position. If the recovery position, okay, if the casualty stops breathing, again start CPR. So again CPR आप start कर देंगे. ठीक है. Arrange urgent transport to the nearest hospital, and after providing the first aid facility, again the first aid provider should take care of his own hands. He or she should wash, should uh, clean his hands with soap and water. If soap is not available, you can use ash, and alcohol-based sanitizers can be used. So with this, the third part of, sorry, the second part of our lecture series is over. And so thank you all of you.